Welcome back to CNN Student News. Our next topic is on concussions.
A concussion is a brain injury caused by a blow to the head or violent shaking of the head and body. It is most common in football, hockey, soccer, lacrosse, and basketball. The signs and symptoms are headache, blackout, fatigue, poor balance, amnesia, disorientation, confusion, sleep disturbances, nausea, vomiting, ringing in the ears, sensitivity to light, and irritability. PCS means post-concussion syndrome. It is a set of symptoms that may continue for weeks, months, or a year or more after a concussion. Retrograde amnesia is a loss of memory access to events that occurred or information that was learned before an injury or the onset of a disease. Anterograde amnesia is a loss of the ability to create new memories after the event that caused the amnesia, leading to a partial or complete inability to recall the recent past, while long-term memories from before the event remain intact. About 10% of concussions result in loss of consciousness. Teen brains take longer to recover than older people. Females are more apt to sustain a concussion than males are. If you expect a concussion, it is best to sit out. The amount of time the athlete should be out of play with a concussion depends on the person, but symptoms usually go away in about 7 to 10 days. The Minnesota Youth Concussion Law implements concussion training and education to improve player safety and establish safe return-to-play policies for athletes who sustain a concussion.
The RTP return to play policy that we here at TG follow is for the athlete to be at all zeros on Mr. Matzel's pain scale for at least 48 hours and then to follow the Minnesota State High School League rules on beginning to ease into playing their sport again.
The Neurocognitive Baseline Testing is an online test that once you have taken your baseline test will have a comparison to your reaction time and memory, and it is supposed to compare your knowledge from before getting a concussion to after getting it. The SCAT-5 is a standardized tool for evaluating concussions designed for use by physicians and licensed healthcare professionals. The SCAT-5 test cannot be performed correctly in less than 10 minutes. Preseason SCAT-5 baseline testing can be useful for interpreting post-injury test scores, but is not required for that purpose. VOMS is a screening tool developed by the experts at UPMC to detect signs and symptoms of a concussion. It stands for Vestibular Ocular Motor Screening and looks at the system's response for integrating balance, vision, and movement. It was developed a few years ago because the tests are at the time only focused on balance, and so we would miss some of the other important areas that we needed to assess. It allows the medical expert to be up to 90% accurate in identifying patients with concussions. It also helps to determine the type of concussion a patient has suffered. As of today, there's a test to diagnose a concussion. There are also no preventative means to be taken to avoid concussions. Helmets and mouth guards do not prevent concussion. The potential long-term effects of concussions are headache, dizziness, difficulty concentrating or completing tasks, irritability, and the sense that you just don't feel like yourself. Some actions that we foresee in regards to concussions and their prevention and management in the NFL level in the future is them trying to make a helmet to prevent concussions and their severity. We also think future actions that we foresee with youth and the prevention of management of concussions is that children will stop playing after they've been concussed a couple times. In conclusion, concussions are a brain injury caused by a blow to the head or violent shaking of the head and body from contact sports with symptoms lasting 7 to 10 days and even longer. It is necessary to sit out of play to make sure your concussion has adequate time to heal. Thank you for listening.